Welcome to an Introduction to Chemotherapy, a presentation for patients and families. In this presentation, we will review what chemotherapy is, side effects of chemotherapy treatment, how to manage these side effects, which symptoms to report to your cancer care team, how to report them, and what supportive care and pharmacy services are available to you. Firstly, we will review what cancer is. Cancer is a disease that starts in the cells of our body. Normally, our body's cells grow in an orderly fashion, but sometimes the information gets mixed up, causing the cells to behave and grow abnormally. These abnormal cells can then develop into lumps or tumors, which can spread to other parts of the body. Cancer is named after the part of the body where it started, for example, breast or prostate. Now we will discuss chemotherapy and how it works to fight cancer. Also called chemo, it is a way to treat cancer that uses drugs to kill cancer cells. There are over 100 different kinds of chemotherapy drugs that can be used. Some patients may be given more than one kind of chemotherapy drug to treat their cancer. Chemotherapy may be used to shrink a tumor before radiation therapy or surgery, destroy any remaining cancer cells after surgery or radiation therapy, make other therapies more effective, or destroy cancer cells that return or spread to other parts of your body. Chemotherapy can be given by intravenous infusion, taken in pill form, given by an injection into fatty tissue, or through an infusion pump over a few hours or days. You may have chemotherapy in cycles, which means a period of treatment and then a period of rest. For example, a 4-week cycle may be 1 week of treatment and 3 weeks of rest. The rest allows your body to make new healthy cells. Chemotherapy treatment may cause side effects. Chemotherapy targets cells that grow and divide quickly, as cancer cells do. Chemotherapy works throughout your body, so it can also affect some fast-growing healthy cells, like those of the skin, hair, intestines, and blood. This is what causes some of the side effects from the treatment. The specific side effects related to your particular drugs will be discussed with you by your cancer care team. You will not experience all side effects, and some side effects can be prevented. Your oncologist will monitor your blood cell counts carefully during your treatment, as chemotherapy can lower this. Low blood cell counts can put you at risk of serious complications, which we will discuss on the next few slides. Blood values must return to a safe level prior to each chemotherapy treatment. Blood test results may affect treatment. It is not unusual for your treatment to be delayed up to 1 week if your blood cells are too low. Blood tests are to be done before noon, the day before your treatment, or in the morning on the day of treatment, on Mondays or after statutory holidays. The lab at the Cancer Center opens at 7 a.m. We ask that you register at the chemo registration desk 3 hours before your appointment if blood work is required on the same day of treatment, or 15 minutes before your appointment if blood work is not required the same day as treatment. When checking your blood cell count, your oncologist is looking at the following: white blood cells, which help your body fight infection. A low white blood cell count leaves your body more open to infection, and if an infection does develop, your body may be unable to fight it off. Platelets, which help your blood to clot. A low platelet count means your body may not be able to stop itself from bleeding. And lastly, red blood cells, which carry oxygen throughout your body. Your red blood cells' ability to carry oxygen is measured by the amount of hemoglobin in your blood. If your level of hemoglobin is low, you're anemic, and your body works much harder to supply oxygen to your tissues. This can make you feel fatigued and short of breath. Blood cell levels may decrease following chemotherapy, but they are expected to return to normal levels by the start of your next scheduled treatment. A low white blood cell count, known as neutropenia, puts you at a higher risk of developing an infection. White blood cells are your infection-fighting cells, and they may be lowered for a short period of time after receiving your chemotherapy treatment. If you develop an infection when you have a low white blood cell count, your body may not be able to protect itself and fight the infection. Infection can lead to death in severe cases. Therefore, it is important to recognize the signs and symptoms of an infection. Signs and symptoms of infection include fever, flu-like symptoms such as body aches, feeling warm, chilled, or shaky, sore throat or mouth, productive cough or shortness of breath, burning when urinating or urinating more often, areas of redness or tenderness, and loose or liquid stools. It is very important to report any of these signs and symptoms to your cancer care team immediately. Things you can do to prevent infection include: wash your hands frequently with soap and water before eating and preparing food and after using the bathroom or sneezing. Avoid people with infections, such as people who are coughing, have a runny nose, or flu-like symptoms. Avoid children who have the chickenpox or measles, or adults who have shingles. The flu vaccine is recommended during flu season. Talk to your oncologist before getting a vaccination. Check with your oncologist before having any invasive procedures such as dental or surgical work. Good oral care is essential, so brush your teeth with a soft toothbrush after eating and before bedtime. Carry a small bottle of hand sanitizer with you as an alternative to soap and water. Avoid handling pet feces, including fish tanks. Avoid skin cuts and nicks. And again, remember to wash your hands. While these strategies will not raise your white blood cell count, they will help to avoid infection. A fever is a temperature of 38.3 degrees Celsius or 100.9 degrees Fahrenheit or higher at any time, or 38 degrees Celsius, which is 100.4 degrees Fahrenheit, or higher for at least 1 hour. A fever is a sign of infection even if you do not have any other signs. A fever is serious when your white blood cells are low. Do not take medications to lower your fever, such as Tylenol or acetaminophen, unless directed by your cancer care team. We recommend that you take your temperature anytime you have signs or symptoms of infection, such as chills, sweats, sore throat, or if you are feeling unwell, before taking Tylenol or acetaminophen for pain, and on a daily basis. Remember that a normal temperature is 37 degrees Celsius, which is 98.6 degrees Fahrenheit, and a fever is 38.3 degrees Celsius or higher at any time, or 38 degrees Celsius or higher for at least 1 hour. It is important to know how to take your temperature properly so you get accurate results. Oral thermometers are recommended to use. Do not eat, drink, smoke, or put anything hot or cold in your mouth 20 minutes before you take your temperature. Turn your thermometer on by pushing the on button. Place the thermometer under your tongue into a side pocket. Close your mouth. Wait for the beep to indicate your temperature has been read. Read and record your temperature. If you have a fever, follow these guidelines. Do not take medication such as Tylenol or acetaminophen to reduce your fever. Go immediately to the closest hospital emergency room. Tell the emergency room staff that you are on chemotherapy and you have a fever. You will need blood work drawn and may need antibiotics. Let your primary nurse and oncologist know of any visit you have had to the emergency room or hospital, why you were there, and what treatment you received, if any. As previously mentioned, platelets are responsible for making clots. Chemotherapy can lower your platelet count and affect your body's ability to form clots. This can put you at risk for bleeding, so it is important to be able to recognize the signs and symptoms of low platelets. A low platelet count can delay your treatment. You may have to wait until your platelet levels go up in order to continue with chemotherapy. Signs and symptoms of low platelets include the following: cuts that won't stop bleeding, bruises on the body, bleeding from the nose or gums, a red pinpoint rash, black tarry stools, and blood in your urine. It is important that you report any signs and symptoms of low platelets to your cancer care team. The following are some strategies to manage low platelets and reduce your risk of bleeding. Use a soft toothbrush when brushing your teeth. Continue regular oral hygiene and use caution when flossing. Use an electric razor to shave. Blow your nose gently. Prevent constipation. Avoid ibuprofen, also known as Advil, and aspirin, also known as ASA, unless ordered by your doctor. And avoid high-risk activities such as contact sports. Red blood cells deliver oxygen throughout your body. Chemotherapy can lower your red blood cell count and lower your energy level. A low red blood cell count is known as anemia. It is important to be able to recognize the signs and symptoms of low red blood cells. Signs and symptoms of low red blood cells or anemia include a lack of energy, fatigue, a pale appearance, shortness of breath, and chest tightness or chest pain. It is important to report any signs and symptoms to your cancer care team. The following are some strategies to manage low red blood cells or anemia. Get plenty of rest. Aim for at least 8 hours a night. Take short naps during the day if needed. Eat well. Food high in iron such as red meat or leafy greens are good choices. Anemia can be relieved with a blood transfusion or with medication to increase your body's production of red blood cells, so be sure to talk to your cancer care team about your symptoms. If you are experiencing chest tightness or chest pain, go immediately to the closest hospital emergency room. Cancer-related fatigue is the most common symptom during and after chemotherapy treatment. It is different than fatigue you felt before you had cancer. It is a feeling of tiredness that can last a long time and does not go away with rest or sleep. It can affect your emotions, relationships, and other parts of your life. It can make carrying out regular daily activities very hard. It is often overlooked, but is real and can be managed. Research shows that exercise is the best way to improve your energy and make your fatigue better. Aim to get 30 minutes of moderate exercise on most days. The activity shouldn't be too easy or too hard. You should be able to talk comfortably while you are exercising. Having cancer is stressful and emotional. Research shows that talking to someone about your feelings or doing activities such as yoga or meditating to relieve stress and anxiety can help your fatigue. Eat healthy foods and lots of variety to have more energy. To stay hydrated, drink at least 6 to 8 glasses of water or other liquids every day. When you are fatigued, you may have less energy for daily activities. Use your energy wisely in order to be able to do the things that are most important to you. Listen to your body and rest when needed. It is common for people with cancer to have problems sleeping, but you can make small changes to get better rest. Wake up at the same time each day. During the daytime, rest in a room other than your bedroom. Limit alcohol and caffeine in the afternoon and evening. Turn off all screens including computers, TVs, and iPads at least 1 hour before going to bed. You don't have to cope with your fatigue alone. Allow family and friends to help you. There are many places to find support in your community and through your cancer care team. The Northeast Cancer Center offers a Fighting Cancer-related fatigue class led by the Supportive Care Program for cancer patients and caregivers. The class offers strategies for coping with fatigue and is available by teleconference. Cancer Care Ontario also has a patient symptom management guide called How to Manage Your Fatigue that can be used by patients and families. Other possible side effects of chemotherapy are nausea and vomiting. Nausea is an unpleasant, queasy feeling or feeling sick to your stomach. Vomiting is throwing up. Not all people receiving chemotherapy experience nausea and vomiting. Your oncologist will give you a prescription to help prevent nausea and vomiting. You can fill your prescriptions at the Northeast Cancer Center outpatient pharmacy or at your local community pharmacy. Bring the medications with you to your chemotherapy appointment. Unless advised, do not take these pills prior to coming to your chemotherapy appointment. These prescriptions can be costly. Let your cancer care team know if you need help financially. Strategies to help manage your nausea and vomiting include staying hydrated by drinking 6 to 8 cups of fluid a day or by sucking on ice chips, eating frequent small, light meals, and keeping your mouth clean by brushing your teeth at least twice daily. It is recommended to avoid hot, spicy, greasy foods, heavy meals immediately after your chemotherapy treatment, and strong smells. Cancer Care Ontario has developed a patient symptom management guide called How to Manage Your Nausea and Vomiting that can be used by patients and family. Contact your cancer care team for nausea lasting longer than 24 hours. Constipation is when you are having bowel movements less often than normal, and it is often dry and hard to pass. Constipation can be caused by some chemotherapy medications, some anti-nausea medications, most pain medications, reduced fluid or fiber intake, stress, anxiety, depression, or a lack of exercise. Strategies to manage constipation include increasing your fluid intake by drinking 6 to 8 cups of fluid per day, increasing your fiber intake, being as physically active as possible, using laxatives such as Senokot or lactulose, and following a bathroom routine. It is normal to have a bowel movement every 2 to 3 days, even when little food is eaten. Do not use suppositories, enemas, or take fiber supplements. If you have not had a bowel movement in 3 days, talk to your cancer care team. Cancer Care Ontario has a symptom management guide called How to Manage Your Constipation that can be used by patients and family. Diarrhea is loose, watery, or unformed stool that happens more than 3 or 4 times a day and can be serious if not managed. Diarrhea can be caused by chemotherapy drugs, antibiotics and laxatives, stress and anxiety, infection, radiation to the pelvic area, or bowel surgery. Strategies to manage diarrhea include taking antidiarrheal medication if prescribed by your oncologist, drinking at least 6 to 8 cups of fluid per day, eating small frequent meals, planning your outings, and taking care of your skin. It is recommended to avoid spicy, greasy, high fiber foods and artificial sweeteners. For diarrhea lasting more than 24 hours, contact your cancer care team. Cancer Care Ontario has a patient symptom management guide called How to Manage Your Diarrhea that can be used by patients and family. Mouth problems is a common side effect of chemotherapy. Within a few days after treatment, you may experience dry mouth and lips, cankers and cold sores, too much or sticky saliva, taste changes, trouble or pain with swallowing, tooth and gum problems, stiff jaw, bad breath, burning mouth, or feeling thirsty all the time. Strategies to prevent and manage mouth problems while on chemotherapy include seeing a dentist before you start your treatment, whether you have your own teeth or dentures. The Cancer Center has a dental oncology team who provide care for patients with cancer before chemotherapy treatment. Patients may self-register to the dental oncology program or ask their cancer care team to make a referral on their behalf. Keeping your mouth and lips moist, brushing with a soft toothbrush, flossing gently, rinsing your mouth 4 to 5 times a day with a baking soda salt rinse, and quitting smoking. It is recommended to avoid mouthwash containing alcohol and petroleum-based lip balm, wearing dentures that do not fit well, eating spicy, acidic, hot, and dry food that have sharp edges, and caffeine and alcohol. It is important to report the following mouth problems to your cancer care team: fever, strong pain in your mouth or jaw, swelling, numbness, heaviness in the jaw, trouble swallowing, a choking feeling, and white patches or red and swollen patches in your mouth. Cancer Care Ontario has a patient symptom management guide called How to Manage Your Mouth Problems that can be used by patients and family. The Cancer Centre also has a patient handout called How to Care for Your Mouth During Active Chemotherapy that includes a recipe for a preventative mouth rinse. Now let's discuss why you should quit smoking after a cancer diagnosis. It has been shown that smoking during cancer treatment can lead to worse treatment side effects, poor healing, and decreased response to treatment. It has also been shown that smoking after cancer treatment can lead to higher risk of recurrence of cancer, increased risk of developing second cancers, and decreased life expectancy. The Northeast Cancer Centre Clinical Tobacco Services Program, which is part of the Dental Oncology Clinic, want to help you quit smoking, and they can provide counseling services, medication, and nicotine replacement therapy. Ask your cancer care team for a referral. Alternatively, patients may self-refer to the program. Let's talk about hair loss and sun safety. Some chemotherapy drugs can cause hair loss. Hair loss can begin 2 to 3 weeks after your first treatment. Your scalp might feel tender when the hair starts to fall out. Your hair will begin to grow back 3 to 4 weeks after your last treatment. The color and texture of your hair may be different. Volunteers in the chemotherapy room will show you hats or turbans if you would like to have one or two. They are free of charge. While you are on chemotherapy, your skin may be more sensitive to the sun, so it is recommended to wear a hat, use sunscreen, and stay in the shade. The following are some resources for hair loss. Your oncologist can provide you with a prescription for a wig, as some insurance plans cover this cost. We recommend you visit a wig shop before you lose your hair so you can match your hair color and style. Donated wigs are available free of charge at the Daffodil Terrace Lodge. Head coverings are available free of charge in the chemotherapy room. The Cancer Centre offers a Look Good, Feel Better program for women. This beauty workshop provides women with the tools and techniques to feel beautiful and vital, restore a sense of self, and renew a feeling of womanhood. The workshop shows women steps they can take so they can look good, feel better, and get closer to the person they were before they began their cancer journey. For more information or to register for a class, contact the Daffodil Lodge. On this slide, we will discuss memory changes, sometimes referred to as chemo brain or chemo fog, that may occur during cancer treatment. Some memory changes that patients may experience include difficulty with concentration, thinking, and focusing. Changes in your memory and concentration may be subtle, or they may be quite bothersome. These side effects may disappear after your treatment is completed. This may also be caused by chemotherapy, fatigue, stress, or insomnia. Strategies to manage memory changes include planning activities ahead of time, making lists to facilitate recall, and asking for help, whether it be from family and friends or the supportive care team at the Cancer Centre. Chemotherapy treatment may cause changes to your reproductive organs and to your hormone levels. Cancer and its treatment can affect your sexuality and sexual function. It can also affect your sexual partners and your relationships. Cancer treatments can interfere with some part of the fertility process and affect your ability to have children. Different types of treatments can have different effects. Men may have a decreased sperm count. If you are interested in having children in the future, speak with your cancer care team about sperm banking. A woman's age is the most important factor that determines whether or not chemotherapy will cause treatment-induced menopause. It is more often permanent in women who are within a few years of natural menopause. It may not be permanent in younger women. Other factors that influence whether or not chemotherapy can lead to treatment-induced menopause include the type of drug, the dose of the drug, and the length of the treatment. The symptoms of treatment-induced menopause are the same as natural menopause. A low sex drive can be caused by cancer treatment from the cancer itself or from treatment side effects like fatigue, nausea, or painful intercourse. The cause of your low sex drive may be short-term or long-term. Birth control is very important for both men and women, and pregnancy must be avoided while on treatment. Talk to your cancer care team or contact the supportive care program if you need guidance with concerns about intimacy and your relationships. The Canadian Cancer Society has a patient booklet called Sexuality and Cancer, and Cancer Care Ontario has one called Intimacy and Sex that are great resources. Here are some tips to help you on your treatment days. The length of treatments vary. Your cancer care team will advise you around how long your treatment will be. Wear comfortable, warm clothing with sleeves that roll up so your nursing staff can access your veins and your PICC line. Do not wear fragrances or perfume, as many patients are sensitive to smells and the hospital is a scent-free environment. This also applies to visitors. You may eat before and after your treatment. Patients are permitted to eat in the chemotherapy room. However, visitors are not. You are welcome to bring your own food and drink with you. Take your regular medications as you normally would on the day of your treatment, unless you have been advised otherwise. Bring all of your medications with you, including the ones prescribed by your oncologist. One support person only per patient is permitted in the treatment room, and children under 12 are not permitted in the treatment room. It is advised to arrange for a ride to and from your chemotherapy appointment. We will now discuss safety precautions while you are on chemotherapy treatment. These precautions are to be followed during and for 7 days after you have received your treatment. It is very important to keep all chemotherapy out of reach of children. It can take up to 7 days to filter chemotherapy out of your body. During that time, your body fluids, such as urine, feces, or vomit, carry small amounts of drug waste. Exposure to this drug waste can irritate the skin and be harmful to others and pets. If chemotherapy or body waste splashes on your skin, wash your skin with soap and water and rinse for 15 minutes. Wear disposable gloves to clean up body fluids such as urine, vomit, or feces. Double bag sanitary napkins, incontinent pads, diapers, colostomy bags in regular garbage bags and put in the regular garbage for disposal at home. Linen and clothing contaminated with chemotherapy or body fluids should be washed separately from other linen or clothing and washed twice in hot soapy water. Flush the toilet twice with the lid down to prevent splashing. Use a condom during sexual activity. Pregnancy and breastfeeding should be avoided while on treatment. Some important points to remember are to bring your completed record of chemotherapy side effects and your appointment schedule with you to each chemotherapy visit, to carry your cancer treatment record with you at all times, and to show it to medical personnel such as a dentist, family doctor, at a walk-in clinic or hospital emergency room if you are a patient there. Complete your symptoms matter report upon arrival for your chemotherapy appointment. Arrive at least 15 minutes before your appointment time, as arriving late may affect other patients. Monitor your temperature daily. Check with your pharmacy before your first chemotherapy treatment to see if any prescriptions may have been faxed there by your cancer care team. And wash your hands regularly. Your cancer care team wants to know if you have certain symptoms, so it is important to call them for the following. If you have had a fever, and after you have been to the emergency room, please notify your cancer care team. If you have mouth sores or mouth pain, nausea or vomiting lasting longer than 24 hours, diarrhea lasting longer than 24 hours, constipation and you have been 3 days without a bowel movement, and for any abnormal bleeding or bruising. Phone messages are taken by a telephone clerk at extension 2900. A nurse will call you back. Please be advised that calls are returned based on the urgency of the symptoms. The Northeast Cancer Center is open Monday to Friday from 8:30 to 4:30 p.m. It is not open on weekends or statutory holidays. Telephone calls are answered by a telephone clerk from 8:30 to 4 p.m. If you have uncontrolled symptoms and the cancer center will be closed for at least 24 hours, please seek emergency room care. The phone number to the cancer center is 1-705-522-6237, extension 2900. The toll-free phone number to the cancer center is 1-877-228-1822, extension 2900. The Supportive Care Program offers counseling to patients and families coping with a cancer diagnosis. They can help with your emotional, physical, and practical needs that might arise due to cancer. Individual appointments and classes are available, and services are available in English and French. Disciplines available include registered social workers, speech-language pathologists, physiotherapists, registered dietitians, and an Aboriginal patient navigator. Healthcare workers in this program can provide professional consultation for nutrition-related questions, physical difficulties or lymphedema, counseling for coping with stress related to having a cancer diagnosis, or help with financial and insurance matters. The Northeast Cancer Center has an Aboriginal patient navigator for patients who are First Nation, Métis, or Inuit, to assist with accessing care and resources when coping with a cancer diagnosis. The navigator can help with transportation, accommodation, medical coverage, and family support. Patients may self-refer to the Supportive Care Program or ask their healthcare worker to make a referral on their behalf. Family members may self-refer for social work services. For further information or to book an appointment, please call 705-522-6237, extension 2175. You can also visit the Supportive Care Program on the first floor of the Cancer Center. Their hours of operation are from 8 to 4 p.m. Monday to Friday. We will now discuss the pharmacy services available at the Cancer Center. The Cancer Center Pharmacy has three main roles: to dispense oral anti-cancer drugs and supportive care drugs, to prepare IV cancer treatment, and to dispense medication for clinical trials. To speak to a pharmacist at the Northeast Cancer Center, you may ring the bell at the pharmacy window or ask a nurse to contact one. Your chemotherapy dose is made uniquely for you based on many individual factors, such as age, sex, height, weight, and blood work results. It is important to let your nurse know if you think that your weight has changed a lot since they last weighed you. Once all the above information has been reviewed and the doctor has confirmed the dose, the pharmacy is then able to prepare your drugs, so please be patient if it seems that it is taking a long time for your drugs to be ready. Chemotherapy is given on a specific schedule called cycles. Oncologists give chemo in cycles, with each period of treatment followed by a rest period to give you time to recover from the effects of the drugs. Cycles are most often 2 to 4 weeks long. The schedule varies depending on the drugs used. For example, with some drugs, the chemo is given only on the first day of the cycle. With others, it is given for a few days in a row, or once a week. Then at the end of the cycle, the chemo schedule repeats to start the next cycle. You will receive written information sheets about your treatment from your primary nurse. Besides the benefit that you can expect from your chemotherapy, there can also be side effects. It is important to know that side effects can vary from drug to drug and from patient to patient. We will not be reviewing every possible side effect today. You can refer to your information sheets to review the side effects generally reported with each drug. However, we will discuss nausea and vomiting. You may receive a prescription for one or more medications to take before your chemotherapy treatment to help prevent nausea and vomiting. Pick up your prescription before your first chemotherapy treatment appointment. You can fill your prescriptions at the Northeast Cancer Center outpatient pharmacy or at your local community pharmacy. If the label says to take 1 hour before treatment, then bring these to your chemotherapy appointment and your chemotherapy nurse will tell you when to take them. There are some exceptions where you will be instructed to start your medication 12 hours before chemo or even the day before chemo. In these cases, you should not wait until you get into the chemo room. These must be started prior to chemo. Read the labels very carefully for these new prescriptions before chemo, and if you are not sure when to take your pills, to please contact your cancer care team for guidance. You may also receive prescriptions for medication to take at home after treatment or on an as-needed basis if you have nausea or vomiting, despite taking medication before your treatment. Bring your regular medications, for example, your pain medication, with you to your treatment appointment so you have access to them while you are at the cancer center. It is recommended that you carry an up-to-date list of all the medications that you are taking, including vitamins and over-the-counter products, as well as your cancer treatment record. Keep these on you at all times, in your purse or in your wallet, so that other healthcare providers can better help you if needed, such as at a walk-in clinic or at the dentist's office. Drug interactions in oncology are of particular importance. Interactions with other medications can cause small changes in the action of the drugs on the body that could significantly alter its ability to work as intended. Your written drug information sheets will list some of the more common drug interactions that can happen with your cancer medicines. You can also talk with a pharmacist about prescription drugs, over-the-counter products, herbal medicines, vitamins, minerals, and supplements regarding drug interactions, food interactions, disease interactions. Natural health products may affect the way your body responds to chemotherapy drugs. Therefore, it is important that you speak with your oncologist before taking any herbal and natural products while receiving chemotherapy. The pharmacist will check drug interactions for all chemotherapy patients, and if there are any concerns, they will speak with you directly in the chemotherapy room or discuss their concerns with your oncologist. While on chemotherapy, it is recommended that patients do not take anything with ASA in it, also known as aspirin, until they have talked to their oncologist first. Low dose, once a day ASA for the heart is usually okay to take. There are many over-the-counter products that contain ASA. Some of the most common are Entrophin, Novacin, Anacin, coated aspirin, Alka-Seltzer, Bufferin, Midol, Robaxisol, and 222s. It is important to check with the pharmacist at the drugstore when buying a product that does not need a prescription to see if it contains ASA. Non-steroidal anti-inflammatory drugs such as Advil, ibuprofen, Aleve, or naproxen can affect your bleeding risk like aspirin does. Speak with your pharmacist if you need over-the-counter pain relief. For general over-the-counter pain relief purposes, it is recommended that you take Tylenol or acetaminophen. However, make sure to check your temperature before taking these medications to verify that you do not have a fever. The Northeast Cancer Center has a research department that conducts clinical trials. This may be a treatment option that your oncologist presents to you, or if you are interested in learning more, you may speak with your oncologist about it. By participating in a clinical trial, you have the opportunity to better your treatment options or outcome of your treatment, help others by improving cancer treatments in the future, and continue to take an active role in your treatment plan. Speak to your medical team about the possibility of participating in a clinical trial or contact the Research Services Office at 705-523-7300 or by email at rso@hsnri.ca. One last piece of advice is for patients to use the internet with caution. There are a lot of websites that provide information that may not be accurate. The following websites are recommended to research your type of cancer and treatment: Cancer Care Ontario, British Columbia Cancer Agency, Canadian Cancer Society, and the National Cancer Institute. Thank you for your time and attention. If you have any questions that were not answered in this presentation, please contact your cancer care team.